Okay, hi. We'll speak about vasculitis today. And vasculitis, by definition, is basically the vessel wall inflammation. And we're going to speak about different types of vasculitis. As you can see, the picture which is going to be projected on your slide is different types of vasculitis. So, based on the pathogenesis of vasculitis, you can divide them according to the pathogenesis. One is immune complex mediated, another one is ANCA associated vasculitis, another one is anti autoreactive T cells, and the last one is your anti-endothelial cell antibodies. So with that, we are going to divide different types of vasculitis into large vessel, medium vessel, and the small vessel vasculitis. Now first, coming on to your large vessel vasculitis, if you take a look at it, you are basically dealing with the larger arteries like aorta and its branches, major branches. So first we'll go into the detail of your giant cell arteritis and Takayasu arteritis, which are the large cell or the large vessel vasculitis. So coming on to the first, the giant cell arteritis, it typically affects the large arterial branches like your carotid artery and its branches like your temporal and the ophthalmic division of your carotid artery. So it does affect both the extracranial artery branches of your carotid artery, the giant cell arteritis. So by the name itself, you get to see that the vessel has a giant cell reaction in it. So the giant cell reaction is basically associated with granuloma in this type of vasculitis. So giant cell arteritis affects temporal and the ophthalmic division, causing unilateral throbbing headache, which is affecting the temporal region, and you get to see the nodular thickening of the temporal artery. Plus, you get the ophthalmic division getting affected with blurring of vision or the diplopia, and ultimately the complication would be the blindness in this case of involvement of ophthalmic division. Then with that, the laboratory abnormalities of your giant cell arteritis is with increased ESR, and the treatment would be a good response to corticosteroids. Microscopy, as the name suggests, I told you, the giant cell, it's always the granulomatous vasculitis with intimal fibrosis. So next, moving on to the Takayasu arteritis. This Takayasu arteritis is basically affecting the large artery, which is aorta, and its major branches. So you're going to get affection of your subclavian, carotid, all the branches of the major branches of the carotid artery, sorry, the aorta. And then we have the Takayasu arteritis clinical features, which is typically affecting the middle-aged women with very weak pulses in your upper limb branches, especially from your subclavian artery. So you're going to get weak pulses in your upper limb arteries, and that's why it's called as pulseless disease, because the inflammation involves the aorta and its branches, and you're going to get aortitis very commonly. And again, the microscopy of Takayasu arteritis is granulomatous reaction with giant cell lesion and with intimal fibrosis, same as your giant cell aortitis. So Takayasu arteritis will have a complication. So remember, you have a vessel wall inflammation. Because of the vessel wall inflammation, you have the weakness. With the weakness, you have the aneurysmal dilation of the vessel wall, and with that you get thrombosis development, aneurysm as a complication. If the aortic inflammation moves towards the aortic root, it can result in aortic valvular insufficiency in Takayasu arthritis as a complication. So that's about your Takayasu arthritis. So now we finish with the large vessel vasculitis. Now moving on towards your medium vessel vasculitis, which affects the medium-sized arteries. So when you look at there are two conditions basically. You have polyarthritis nodosa and the Kawasaki disease, which affects your medium vessels. So polyarthritis nodosa is an immune complex deposit disease. So this immune complex deposit disease is basically developing due to the infection, post-infectious process, or the post-drugs like amphetamines. So post-infectious, especially hepatitis B and hepatitis C infections, are the two common infections which can lead towards the polyarthritis nodosa. So post-infectious hepatitis B, hepatitis C, the antigens persist and you develop the autoantibody against this antigen, and you develop immune complex with the circulation, and that immune complex is going and getting deposited in multi-systems like your GIT and renal vasculatures. So GIT, renal and central nervous system vasculatures can be affected by these immune complex mediated polyarthritis nodosa. So you get features of central nervous system hemorrhage, gastrointestinal hemorrhage and renal hematuria. So that's why polyarthritis nodosa is very dangerous and it can result in renal failure also. So with that, the microscopy of the polyarthritis nodosa basically consists of necrotizing vasculitis, and in this type of lesions, polyarthritis nodosa, you tend to get 3 lesions in the same artery, like necrotizing lesion and the healing lesion and the healed lesion. So the artery will have different stages of necrosis. One is the necrosis part, another one is the healing part, another one is the healed part. So it has different stages of inflammation or inflammatory process in the same artery going on. So that's one characteristic feature of polyarthritis nodosa, and it is not an ANCA-associated vasculitis. It is purely an immune complex mediated vasculitis. Next, moving towards your Kawasaki disease, it's very important. It's typically affect all the children's basically in the geographical region of Japan, Hawaii and the mainland USA. So these are the areas where you get to see the Kawasaki disease, and typically it's post-viral infection. You get this anti-endothelial cell antibodies, and with that you develop a classical clinical features of oral and conjunctival erythema, and you get erythema over the palms and soles, plus you get those desquamative rashes over the skin, and plus you get edema of the hands and feet, and with that you have necrotizing vasculitis of the medium-sized vessel, and not the last but not the least, you get lymphadenopathy in this cases also. So in this case, the vasculitis typically affects the coronary arteries. So this coronary artery is affected by the necrotizing vasculitis, and that's going to lead towards weakness of the vascular wall with thrombosis and then embolism. So that's why you're going to get myocardial ischemia. So the most common complication the Kawasaki disease will get you to is the myocardial ischemia. So you might develop, children might develop myocardial infarction in these cases. So the best treatment is going to be the intravenous immunoglobulin therapy. That's the best treatment you can give to these patients. Next, we'll move towards the three vasculitis which are all ANCA associated. So we saw the large vessel vasculitis which are due to autoreactive T cells, and then we saw medium vessel vasculitis which is one is immune complex mediated, another one is antibody mediated, and now the last but not the least, we are dealing with the three diseases which are ANCA associated. And that ANCA associated is, the first one is your microscopic polyangiitis, where you have the vasculitis, you get the necrotizing vasculitis, but with no granuloma and no eosinophils. So in this, you have necrotizing vasculitis affecting skin, GIT, lung, renal, all these organs. So all the vasculature of these organs are going to be affected by your microscopic polyangiitis. So that's why it's also called as leukocytoclastic vasculitis or the hypersensitivity angiitis. Again, this pathogenesis is ANCA associated disease. You're going to get